Barrett's esophagus. Hi, I'm Dr. Anton, a Melbourne-based gastroenterologist, and I'm going to do a deep dive into Barrett's esophagus. What is it? What are the causes? And what's the treatment? Barrett's esophagus is a condition in which the normal lining of the esophagus, the tube that connects the mouth to the stomach, is replaced by abnormal cells. These cells are similar to those found in the lining of the intestine. This change in the cells is known as metaplasia, and it often is associated with chronic acid reflux, also known as gastroesophageal reflux disease or GERD. The exact cause of Barrett's esophagus is still unknown, but it is believed to be primarily caused by long-term exposure to stomach acid due to chronic reflux. When the acid from the stomach constantly refluxes into the esophagus, it can cause irritation and inflammation, leading to changes in the lining of the esophagus. Other factors that may increase the risk of developing Barrett's esophagus include obesity, smoking, and a family history of this condition. One of the challenging aspects of Barrett's esophagus is that it often does not cause any symptoms. However, some individuals may experience heartburn, chest pain, difficulty swallowing, or feeling of food getting stuck in their throat. It is essential to note that these symptoms can be indicative of other gastrointestinal conditions, so it is crucial to consult with a gastroenterologist for an accurate diagnosis. Diagnosing Barrett's esophagus typically involves a series of tests and procedures. A gastroenterologist may perform an upper endoscopy, where a thin flexible tube with a camera is inserted into the esophagus to examine the lining and take samples from tissue. Additionally, imaging tests such as a barium swallow or esophageal manometry may be conducted to assess the function and structure of the esophagus. Once diagnosed, the treatment of Barrett's esophagus depends on the severity of the condition and the presence of dysplasia, which is the abnormal growth of cells that can progress to cancer. For individuals with no dysplasia, lifestyle modification, such as modifying trigger foods, elevating the head of the bed, and weight loss may help manage symptoms and prevent further damage to the esophagus. Medications that reduce acid production in the stomach, such as proton pump inhibitors, are often prescribed. In addition, smoking is a key risk factor for Barrett's esophagus and should be ceased. Individuals with Barrett's esophagus are recommended to undergo regular monitoring and surveillance to detect any changes in the cells that may indicate a higher risk of developing esophageal cancer. This typically involves periodic endoscopies with tissue biopsies to evaluate the progression of the condition and determine the appropriate course of action. It is crucial to follow the recommended surveillance schedule to ensure early detection and timely intervention if needed. In addition, it's important to find a skilled gastroenterologist who is trained in detecting Barrett's esophagus, as careful inspection by a trained professional can help identify lesions early and prevent the development of esophageal cancer. Although the majority of individuals with Barrett's esophagus do not develop cancer, there is an increased risk compared to the general population. The risk of cancer is higher in individuals with more severe changes in the cells, known as high-grade dysplasia. If left untreated, Barrett's esophagus can progress to esophageal adenocarcinoma, a type of cancer with quite a poor prognosis. Therefore, early detection and management of the condition is essential to reducing the risk of cancer. Barrett's esophagus is a complex condition that requires careful monitoring and management to prevent complications such as esophageal cancer. If you or a loved one is experiencing symptoms of acid reflux or have been diagnosed with Barrett's esophagus, it is essential to consult with a gastroenterologist for a thorough evaluation and personalised treatment plan. Remember, early detection is key to maintaining good gastrointestinal health and overall well-being. Note, this video is not a medical consultation. Any medical information is general in nature and is not intended to provide individual clinical advice. You should contact your doctor or other healthcare professional in relation to any concerns they may have, as your own circumstances may be different. Subscribe for more videos on all things gastroenterology, and if you'd like more information or to book a consultation, visit our website.